Okay, so this Valentine's Day, we talked about cardiovascular health. And if you missed the news segment this morning, no problem. The link is posted on our website. But I want to go through some of the most important points with you today because as females, it's so important to know the warning signs, what to look out for, and what you can do to help prevent or mitigate a cardiovascular event. So we know cardiovascular disease is the leading cause of premature death in women. 5 times more women are likely to die from heart disease than they are from breast cancer, which is surprising for a lot of people. The difference is in women versus men, how your symptoms present. So men typically get that crushing chest pain. Women don't necessarily have to have that crushing chest pain. They are usually predisposed to symptoms like 3 to 4 weeks prior to an attack. And it's like very deep fatigue, shortness of breath without doing anything, so tired. Symptoms are worse lying down than they are standing up. And also this pain that's in your neck, your jaw, and maybe your back from the chest radiating to the back. Men also experience pain in their left arm. Women, it can happen in either arm, right or left. So those are things that you really want to pay attention to. The average age for a heart attack in men is 66 and in females it's 70. The reason for that is that estrogen actually protects us later until after menopause. So we have that on our side. But as females, we have risk factors that men don't have that predispose us to cardiovascular disease. So things like endometriosis, polycystic ovaries, gestational diabetes, and preeclampsia, which is high blood pressure in pregnancy. Those all predispose women to cardiovascular events. So important to pay attention to your signs and symptoms, know your baseline, know your blood pressure, know your cholesterol, stop smoking, maintain your weight. These are all vitally important to the health of your cardiovascular system. You also want to limit your sodium. So we talked about that, how salt raises your blood pressure, and by doing potassium-rich foods that can offset your sodium. My recommended amount of sodium is 1,000 milligrams a day, which isn't considered high by the standards, but I even think that that's high. Try limiting your sodium to less than that and drink a lot of water to help flush out your sodium. Potassium also helps flush out your sodium. Things like omega-3 fish oil to increase your good cholesterol, CoQ10 to increase the energy output of your heart, magnesium, which dilates blood vessels and relaxes muscles. Your heart is a muscle, so magnesium helps to relax all of those blood vessels. Those are 3 really helpful supplements that you can take. And just knowing your signs and symptoms is, like I said, one of the most important things. Also keeping an aspirin on hand. Everyone should have aspirin at home. In the event that anything does happen, you chew an aspirin or put an aspirin under your tongue for yourself, a loved one, anyone who you think might be having a heart attack. It is a very easy, simple thing to keep at home, and it could help save a life. So I hope those tips help. Women especially, these tips are for you, and happy Valentine's Day.